And we're going live. Hello, it's Bill, the Knee Pain Guru. Today is Friday, May 14th, 2021. Today we're going to talk about options for knee replacement surgery. For those that aren't into getting the bones in their leg cut off and replaced with plastic and metal, we're going to talk about other things you can do. And what happens is most people think about knee replacement surgery. They get diagnosed as a perfect candidate for knee replacement surgery by their doctor, their surgeon. They're dealing with their knee pain. They've done the shots, they've done the drugs, and now it's getting to a place where the knee, they had arthritis, and this is a spectrum. It starts with a little bit of arthritis, and then it gets worse, and then they get diagnosed with bone on bone. And usually the doctors want to figure out a certain age range to have the surgery in, have the knee replacement surgery in, because the joints are only rated for about 15 to 20 years. So they want to make sure you only have to do it once. So they're banking on you dying before the knee replacement fails, so you don't have to have a second one. It's kind of a really sad outlook on what the medical model, how they look at joints. So then you have people will look at, well, maybe I only have to have a partial replacement, or I'll get a total replacement, or I'll do one knee at a time, or I'll just do both knees to get it over with. And it's really, when you're looking at those options, you're looking at a bad option or a worse option. And today we're going to talk about different options, because this was Deborah had written in. This was on some of the videos over the past week that I've recorded around different things, different subjects around knee pain. So Deborah was saying she's supposed to have a total knee replacement soon. I need to stay in rehab for a couple of weeks because my bedroom is upstairs. Not totally understanding the bedroom upstairs kind of piece. However, I asked her, are you looking forward to the knee replacement? And she said, not really, because it's a lot. And she goes into talking about losing 10 pounds, and she's been sleeping on a cot, and the difficulty going to the bathroom. The bedroom's upstairs. Would like to stay at the rehab facility for a while if it's possible. She's 62 years old and have had the shots in the rehab. Well, it's kind of the playbook for the conventional medical model. They are looking at, until you can't handle the pain anymore, then we'll cut the bones off in your leg and replace it with plastic and metal. Not a real good outlook. And usually on the other side of that, there's a whole lot of challenges that you still got to work with. And you'll never squat. You'll never get your heel to your butt again. Like, that's a baseline. The knee replacement only goes so far, and you stop at that spot. So the leg, there's challenges fully extending and fully bending the leg because of the replacement. So what are we looking at? And here is where, if we take a step back and look at the landscape of what you're dealing with a knee replacement surgery, or why anyone would even consider a knee replacement surgery. And I've asked this of thousands of people over the past 20 years. Why do you go to the doctor? It's one of two things. It's either pain in the knee, and they can call it pain or achiness or tightness or discomfort or whatever it is. There's pain or range of motion issues with the knee. They can't do what they want. They can't squat down. They can't get up out of bed. They can't get up and down from the floor. So if we look at the pain and range of motion, forget the diagnosis for a moment, but just focus on the pain and range of motion, and we just deal with that. What is going on in the knee, in the legs, in the hips, in the lower back, that is causing difficulty with pain or range of motion? And if we start changing the neurological signaling in the knee that decreases the pain and increases the range of motion, all of a sudden you don't have these issues anymore. Do you really care about the bone on bone situation with your knees? As many people get stuck in the diagnosis. The diagnosis is not you. The diagnosis is what the doctor needs to call it. The diagnosis is what the doctor needs to call it in order to write a prescription or do some procedure. It's a legal thing. It's a medical thing. They have to label it as something. And if they don't label it, then they're personally liable. And of course, doctors don't want to be liable. Don't blame them. The point of what I'm saying is, if we start focusing on the issue at hand, which is the pain and the range of motion, getting your knees more comfortable on a daily basis, and then setting up the conditions in your knee and in your body to support the healing of your knees, so your body has the resources it needs to heal the knees, and then make sure you don't self-sabotage in the process, your body actually heals quite quickly. Now, are there situations where you have a bone on bone and you have to get a knee replacement surgery? Absolutely. Certainly. It's always an option. It's always an option for surgery, any surgery. However, wouldn't you want to exhaust all your efforts? Try something, even if there was uncertainty with it and you were unsure about it, in order to avoid a knee replacement surgery. So that's the approach. Comfort is the key. Comfort is the cornerstone. And this is what I was talking about. One of the clients at Join Knee Club. We'll get into this in just a second. If you have questions, there's a few people on the line here. Excuse me. If you have questions, as we're streaming live on Facebook, YouTube, Periscope. If you have questions, put those in the comments section. I'll be happy to answer them about your knees, physical therapy, knee replacement surgery, whatever it is, and we can dig into that. But we have to look at creating a baseline for you right now. Your baseline right now is pain, struggling with movement. And this was Ed. He's out of Pennsylvania. He's coaches baseball for his grandsons, and frustrated that he can't move the way he wants to, and lots of pain. He had lots of pain in his calves and in his shins and in his knees. And over the past couple of weeks, he's only been working in the program a couple of weeks, the focus is on reducing his pain to get a baseline of comfort all the time. When he gets to a baseline of comfort, then if he does something that causes pain, it's easier to address the thing he did that's causing him more pain, while we're increasing his flexibility, while we're increasing his mobility, while we're increasing his strength. This is where I see the conventional physical therapy, the conventional medical model kind of missing it, is that they want you to focus on strengthening the legs while you're still in pain. So you have a dysfunctional tension pattern, and now you're pushing through pain. So you go to physical therapy, and now you're in pain for days later because of the physical therapy. I've even had clients tell me they have to take prescription medication in order to get through physical therapy. You have to take a step back and look at, is this really getting me where I want to be or where I want to go? If you need to take prescription drugs in order to get through the painful physical therapy, is it really making your knee better? Well, I bet dollars to donuts, probably not. So we have to take a step back. And this is only you can do. You need to do this. You as the knee pain sufferer, you as in this situation going, this is ridiculous. You have to take a step back. It's your body. These are your decisions to make. And just because a person has a degree, has a license, whatever that might be, you have to look at it from a common sense approach. Does this really make sense? Okay, I have 18 physical therapy appointments that insurance is covering. And every time I go, it puts my knees in more pain. I get the deductible, the whole deductible and the cost of that. But you got to really think, is it helping you? Is it making a difference? Or is it making your situation worse? This is what you have to look at. This is what you have to empower yourself with the knowledge and understanding of your own body and the situation around you. Take ownership of that. It's going to make a big difference. If you got questions, please put those in the comments section. If you want to know, what are your next steps? Like we were talking about Deborah. She's done the drugs. She's done the shots. It's not necessarily helping. So where can you go right now? You can go down below this video. I have website. Here, I'll put this on here. Chris is, hey, Chris, I see you. I see you there. kneepainguru.com. You can go there. I have a newsletter you can sign up for. You can sign up for a consultation. And then I also have my group coaching program, Knee Club. And I'll get into that in just a second. I'm going to see what Chris had to say here. Okay. Chris says, my meniscus gave me issues for months, tiny tear. As soon as I started forgetting about it, I'd say 90% improvement in 2 weeks, never approached traditional physical therapy. Yep. And there's a lot of it. There's a lot to say on the more we focus on the discomfort that we have, the more it creates a bigger issue. So by focusing on something different, we can begin to create a different reality. It's a different neurology. That's part of when I talk about changing in the neurology is not only in the knee, it's in the leg, it's in the hips and lower back, it's in the mind, it's in your entire body. It's a tension pattern that is going on that is creating all the pressure to go down into your knees. In the knees, we change that neurology. What do you say here, Chris? By forgetting, let go. Better word, released circuits. Yeah, I mean, however it clicks for you is great. When you feel it, there's an immediate, like if you get to the right spot, and Chris, I could use this example of striking in martial arts. If you hit the right spot with the right timing, the body drops. It just what happens. Because you hit the right spot at the right time, the neurology shuts off and the body shuts down. And it's the same thing when you're working with a situation with the knee, that when you get the right position of comfort in the joint, working with the intrinsic movement of the joint, you change the neurology of what's going on with the knee. And you have a different experience that begins to fire 286 miles per hour. That's how fast the neurology fires. And then everything's different. Then we have a different reality. We need to begin to integrate that different reality on the other side of the experience of relief you have in the knee. Making sure the body has the resources it needs to heal that change, support that change, and then make sure you're not going into the old habit of doing the things that are causing the problem that got you in pain to begin with. So it's simple. Okay. You can go down below this video, thekneepainguru.com, sign up for my newsletter, schedule a consultation. We can go over strategy of what's going on in your knee situation and get you either a natural approach or an integrated approach with what you're currently doing, figure that out, map that out for you, or we talk about Knee Club, which is my group coaching program. We work in it's a Zoom room twice per week. You tell me what's going on. I give you specific videos to work with in the members area of my website. And you do those for homework. And then on the next call, you show up and you say, hey, this is what happened. This is what I noticed. This is what changed. This is what shifted. It relieved the pain. It didn't relieve the pain. The pain moved. The pain changed somehow. And then we use that to discover the path for you, a customized program for you to get your knee out of pain. So that's what I got. Chris, thank you for being here. Thank you to all those that are following the channel. Make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. And I thank you so much. This is Bill Paravano, the Knee Pain Guru. We're going to sign off for today. Have a wonderful day. I'll see you on the next one.